Thank you so very much. I would first like to begin by expressing my gratitude to Reggie Revis, Nakia Bailey Hawes, and the UNC Health Black Alliance Employee Research Group for inviting me back to my alma mater to share today's keynote address with you. As Reginald has just mentioned, I am an alum of UNC and was home trained to root for the Tar Heels, even though I do also possess a Duke degree, just in case you were wondering. During the 1996-97 academic year, I literally wore a new footpath between the psychology department at Davie Hall near the Well, where I was completing my PhD in clinical psychology, and UNC hospitals, specifically the pediatric nephrology and infectious diseases clinics, as well as the wellness clinic at the ambulatory care center. UNC was very gracious in supporting the completion of my dissertation data collection, and for that I owe a great debt. Additionally, I would like to commend each and every staff member, faculty member, administrator who is present today. You all have shown up in impressive numbers. And I'd like to commend you for the vitally important work that you're doing to sustain and enhance life, both in terms of quantity and quality, especially during this pivotal time of the poly pandemic. We are not only experiencing COVID-19 and its own unknown number of variants, but we're also struggling with the pandemics of grief and loss, political unrest, social injustice, xenophobia, marginalization of LGBTQ plus communities, and socioeconomic inequities, just to name a few of the aspects of this poly pandemic. These events have been traumatizing, especially for people who may have already been suffering from the effects of what Dr. Joy DeGruy calls post-traumatic slave syndrome. Nevertheless, in the midst of this pandemic, your labor has not been in vain. I would like to share a few slides with you as I talk today from the subject of the drum major instinct, how King's legacy points us to service in healthcare. I would like for you to sit back, perhaps close your eyes, like any good psychologist might encourage you to do. And I want you to use your spiritual imagination to go back in time. It's mid-morning on February 4th, 1968. And unbeknownst to you, in exactly 2 months from this day, Dr. King will, in fact, be assassinated. You are a nurse, and your name is Doris, and you just happen to have worked the night shift. The civil rights movement, led in great part by your very own pastor, Reverend Dr. Martin Luther King Jr., has led to some great shifts in voting rights and in the desegregation of schools, restaurants, and other community settings. But at Grady Memorial Hospital, where you work, the so-called separate but equal facilities result daily in Black patients receiving inferior treatment compared to those at the white Grady. At the understaffed and under-resourced Black Grady, it was not unusual for a dying patient to be refused emergency services. Parenthetically, my father, who I believe is on this call, has shared with me that in his upbringing, he and many members of his small town community in South Carolina were afraid of hospitals, mainly because most of the family and community members who entered therein never made it out alive. Being the attuned pastor that he is, Dr. King is aware of your plight as a healthcare worker. Even though Dr. King was trained as a pastor and theologian, his activism long ago elevated him to political influence, even in the medical realm. In fact, King spoke these words at a press conference just a couple of years ago before the 1966 convention of the Medical Committee on Human Rights in Chicago. And King said, "We are concerned about the constant use of federal funds to support this most notorious expression of segregation." There he was speaking of racial segregation of hospitals. Of all the forms of inequality, injustice in health is the most shocking and the most inhuman because it often results in physical death. I see no alternative to direct action and creative nonviolence to raise the conscience of the nation. I'm certain that you've heard that quote before, and we often use the term inhumane, but he actually talked about how inhuman the racial segregation that he witnessed was. So you will see from slide 3 that firsthand at Grady, you know physical death has indeed been rapidly occurring for the Black patients, and more so at the Black Grady than the white Grady. In fact, your mother has just been admitted to the hospital, that very hospital, with cardiac challenges, and you cringe and shudder, not only at the thought of the inferior care that she may very well have to endure, but also at the very real possibility of losing your mother as a result. Exhausted and discouraged by this healthcare quandary, you nevertheless press your way to the church house, Ebenezer Baptist Church over in Sweet Auburn, to receive a word of encouragement to bolster your weary existence. Like any Black Baptist preacher worth his salt, Pastor King announces as his subject the drum major instinct, and lifts his text from Mark chapter 10, verses 35 through 45. From that gospel account, King describes how Jesus' disciples, James and John, the sons of Zebedee, have requested to sit on his left and right at the throne. In other words, they wanted to be numbers 2 and 3 in the kingdom of God. As Vice President Reese put it, they wanted a hookup. Maybe they even wanted to be the junior HNICs. Using my sanctified imagination, I can hear Jesus just barely suppressing the thought, silly rabbit, power grab tricks are just for kids. But that's not what Jesus says. To the contrary, Jesus mildly remarks that those assignments are not his to make. Upon encountering the mumbling disciples who've since caught wind of James and John's request, Jesus directly addresses their concerns. Rather than chiding James and John for wanting to be great, he redefines greatness to all of the disciples. For reference, Jesus points to the Gentile rulers around them who throw their weight around. In fact, according to the Message Bible translation, Jesus observes that those leaders let a little power quickly go to their heads. Instead, Jesus makes the radical statement that those who would be great must be servants of all. Now, your astute pastor breaks it down even further, associating this impulse to be great as the drum major instinct, as you can see from slide 4. The drum major is first in the parade, helping the marching band to keep tempo and helping to maintain structure and organization. You'll often notice that the drum major in any parade is more ornately dressed than other members of the band. Also, the drum major often gestures with flair and sophistication, making it all look so easy, but supremely aware of what is riding on those decorated shoulders. On slide 5, we have more detail about the drum major instinct. It's the desire to be out front and to receive praise. Dr. King even called that praise like vitamin A to the ego. Dr. King remarks, "You ought to be significant. Don't give up this instinct. It's a good instinct if you use it right. It's a good instinct if you don't pervert it and don't distort it. Don't give it up. Keep feeling the need for being important. Keep feeling the need for being first. First in love, in moral excellence, in generosity." In sum, Pastor King reminds the congregation that everybody can be great because everybody can serve. Now, you're not Doris, and you're here in 2022 wondering, how can I serve in the midst of this poly-pandemic? You don't know about my supervisor or my coworkers. You haven't met my patients. You don't know this health system. Oh, I'm sorry. I'm sorry. I got my papers confused. That was the speech for the other health system. I'm sorry. I forgot who I was speaking with. I know that you don't have those challenges at UNC Health. The reality, though, is that even though legalized segregation in hospitals and health systems has ended, de facto segregation continues to rear its ugly, hideous head in many forms. For example, you can see from this example that I'll share with you of how racialized segregation and other types of inequities may be alive and well in 22. For example, depending on the type of ownership that a hospital or a health system may have, that ownership type may contribute to low transparency in many of its operations. There may also be barriers pertaining to the physical location of the health system, managed care contracts that are or are not held, all forms of institutional discrimination that can occur, challenges with transportations, perhaps not being offered broadly enough, frequently enough, emergency department capacity. Is it appropriate for the neighborhoods in which the health system or hospital is located? Access to quality providers, high quality providers, and also access to specialized services. How far do our patients and families have to travel in order to connect with the services that they most desperately need? So, if King were still here, he would be preparing to celebrate what would have been his 93rd birthday tomorrow, the 15th. He would be greatly distressed about what has developed within the health inequity. Slide 6. Health inequity emerges from social, economic, environmental, and structural disparities that contribute to intergroup differences in health outcomes, both within and between societies. You can also see from the next slide that there are differences in the leading causes of death. If you look first at the comparison between non-Hispanic white females and non-Hispanic Black females, you can see that there are some commonalities in the top causes of death. For women, there is a difference in the third leading cause of death, that being chronic lower respiratory diseases for white females and stroke for Black females. You also see that diabetes figures higher than it does for white females. But if you look at the next slide, you can see in a comparison of non-Hispanic white males and non-Hispanic Black males that heart disease and cancer, unintentional injuries are all the same for both groups. But suddenly, under the Black male group, we see that one of the leading causes of death, the fourth leading cause of death, is homicide. Homicide is a preventable disease, if you will. It, in fact, is not a disease. I would suggest to you that it is a social disease. And so it makes us wonder about what it is systemically and institutionally we may be doing or not doing enough of to create change. So you may be wondering, how has the U.S. created and continued to feed this dreadful monster, this perfect storm of inequities in the realm of health? The next slide talks about, if you can see there, some of the barriers to healthcare equity. So one of the things that we notice is that the World Health Organization has noted several inequities in healthcare, including age, the rising cost of healthcare, lack of access to health insurance, disparities in care, and the reality that low-income individuals are more likely to be sick for several reasons beyond their control. Unfortunately, and yet increasingly more commonly, poor health itself can create poverty. For example, I'd like to share a personal story. One of my cousins, a 13-year-old, was recently hospitalized in Philadelphia following a dog attack that resulted in a car accident. Having been in a coma for several days when the doctor thought that he was brain dead, this young man fought the odds and ultimately learned to walk again. Our family rejoiced when he recently walked out, and he literally walked out and told them not to send a wheelchair to his room because he would not be needing it. So he walked out of the hospital 3.5 months later. However, the only thing that was higher than our spirits that day is that impending medical bill, the half of which has not been told. I'm sure you understand what I mean. So, another significant barrier to healthcare equity is mistrust of the medical establishment. I learned much about the breadth and depth of this barrier during my doctoral studies in the mid 90s when I began working on a research study sponsored by the Minority Health Project and UNC's School of Public Health. This project was a collaboration between maternal and child health, epidemiology, and biostatistics. My colleagues and I, most of whom were public health graduate students, studied patterns of mistrust in the medical establishment by conducting 3 focus groups. One was comprised of students that were white at UNC, one was comprised of Black students at UNC, and a third group was comprised of Black students at North Carolina Central University. We learned that while most of the Black students at both schools were familiar with the Tuskegee syphilis study, few of the white students were aware of that now infamous experiment that continued from 1932 to 1972, and perhaps would have endured even longer had the story not been broken by the newspapers. So, in addition to the direct impact of this study on many Black families, stories of medical mistreatment continue to circulate and even multiply within our Black communities. Positively, one of our findings from that paper was that although Black students in our study expressed suspicion of healthcare institutions, they reported that these suspicions were ultimately not associated with decreased participation in research studies. Conducting and participating in research is one very concrete way that King would approve of as service to greater humanity. Other factors contributing to mistrust of the healthcare system include medical experimentation, as you can see on the next slide, reproductive procedures on enslaved women without anesthesia, for example, sterilizations that resulted from the eugenics movement, radiation experiments on Black Americans, research on prisoners and children without consent, and bioterrorism in Carver Village in Miami, Florida, and Savannah, Georgia. And there are so many more stories that we could add, sadly, to the ways that the medical establishment has not served and indeed has harmed Black populations. So there are many external reasons and barriers to access to healthcare, but there are other barriers I'd like to suggest as well. There are barriers such as a dearth of affordable treatment options for African American populations, and for that matter, for any populations that may have economic challenges. You may have also heard of the strong Black woman disorder, or perhaps you've heard of John Henryism, attitudes such as resistance to accepting help or powering through our challenges, even at the risk of our own demise. Some additional impediments that occur in the arena of mental health care include the role of stigma and the low numbers of BIPOC mental health professionals. An American Psychological Association report found that only 4% of psychologists in the United States in 2015 were Black, even though Black people represent 13% of the population. A similar disparity exists among social workers and psychiatrists. Research demonstrates positive outcomes for members of minoritized communities who receive treatment from white mental health professionals. However, the entrenched legitimate depth of mistrust is often a wide chasm that is difficult to traverse. While geographical access has been a traditional barrier, one serendipitous discovery during COVID is how effective telemedicine and telemental health can be for the vast majority of the public seeking routine care. In many cases, healthcare professionals licensed in North Carolina can use such technology to treat patients from Murphy to Manteo. Noting the general overwhelm of the masses, or as Michelle Obama observed, our collective low-grade depression, the Armstrong Center for Hope set out in the fall of 2020 to conduct a research study engaging the talents of our master's level psychology interns from North Carolina Central University. In this study, we examined creative strategies for increasing mental health service utilization in Black populations during COVID. It is significant that the focus of this study was how professionals in mental health, not the prospective clients themselves, could help turn the tide of traditionally low rates of utilization. Perhaps unconsciously vibing with the drum major instinct, we hoped that we could lead by our service. As you can see from slide 11, there was data we collected from our providers representing social work, psychology, mental health, counseling, and marriage and family therapy. And they revealed that our predominantly Black clientele had been disproportionately affected by COVID-19. Specifically, the group cited concerns about financial and health-related concerns due to the loss of employment, the devaluation of life, insecurities about safety, exposure of essential workers, and racial and ideological tensions around mask wearing. It's notable that at the time of this paper, vaccines had not yet been made publicly available. One of our associates shared the poignant theme of many Black families experiencing deaths during COVID without the typical traditions of funerals and gatherings to support and comfort the family. On slide 12, I share a bit about some of the ways that COVID impacted our staff. And given COVID, we have not been able to get together and take a group photograph. And so I apologize that the pictures on the slide are a bit small, but it gives you a sense of some of the variety of our staff members at the Armstrong Center. Briefly, we found that when we asked about how they were dealing with COVID-19, we learned that 71% reported increased anxiety, 64% reported social isolation that was related to greatly diminished social outlets, and 64% reported sleeping challenges. It's perhaps no surprise to you that the DSM, the so-called Bible of the mental health professional, does not diagnose the conditions of the soul. Just like many of you, our staff struggled with disruptions of their social activities, challenges in working remotely, observing their children struggling to learn in virtual environments, feeling the pain of grief and loss, and witnessing and/or experiencing social injustice. Dr. King himself spoke prophetically about the suicidal thrust back in this 1968 sermon. But you can see from the slide, perhaps not even Dr. King would have dreamed, or more appropriately for this context, experienced the nightmare of the pandemic suicide that is affecting our world, and even more specifically, our children. In 2018, before the pandemic, suicide was the second leading cause of death among 10 to 14-year-olds, 15 to 24-year-olds, and 25 to 34-year-olds. However, during mid-February to mid-March of 2021, emergency department visits in a CDC study showed that there were suicide attempts for those visits that rose by 51% among girls aged 12 to 17, and by 4% among boys in the same age group compared to the same month period back in 2019. Among Black children, suicide had already become the second leading cause of death for ages 10 to 14, and the third leading cause of death for ages 15 to 19. During the pandemic, Black boys and girls have demonstrated higher rates of suicide attempts. Additionally, adolescents of color who identify as LGBTQ may be especially at risk of a suicide attempt, according to a national survey conducted by the Trevor Project, which is a suicide prevention group for LGBTQ youth. So the needs for support are great, and our opportunities to be great also multiply. So as I bring this to a close, during the famous sermon on the drum major instinct, King asked Nurse Doris then, and asks us now, to consider how we can harness this drum major instinct. How do we show our best selves? We can be at our greatest when we lead and serve in the roles that we occupy right now. That doesn't mean that we can't or shouldn't strive for greater fulfillment of our purpose as we evolve through education, work experience, certifications, and navigating what poet Mary Oliver referred to as this one wild and precious life. By focusing on servanthood, Jesus, and King by extension, was not suggesting that we neglect self-care. In fact, one of the major conclusions of our ACFH study was how those who serve significantly must also be engaged in replenishing through self-care in a significant way. So in the end, King firmly identified that we do not need to aggrandize ourselves or puff ourselves up through consumerism or exclusivism, belonging to more and more groups. After all, the more time that we use in attempting to keep up with the Joneses through our material possessions, social networking, and self-absorbed strivings, the less time that we have to show concrete displays of compassion for another's plight. As healthcare workers, you see daily the patients, families, diagnoses, and data that tell the stories of inequities. As those who embody King's dream, I recommend that you begin where you are planted. If you can't fly, then run. If you can't run, then walk. If you can't walk, then crawl. But whatever you do, you have to keep moving forward, said Dr. King. Whether your sphere is the OR, the clinic, the billing office, the cafeteria, the C-suite, or the IT department, use the drum major instinct to propel you to the highest calling, that is, serving others. Remember, everybody can be great because everybody can serve. Your compassion and conscious service will help to shift our society toward equity in all levels of healthcare and human life. Even now, Reverend Dr. Martin Luther King Jr. declares, we must accept finite disappointment, but never lose infinite hope. Thank you.